I'm Dr. Richard Blanks. I'm going to talk about rotator cuff surgery since this is one of the most common procedures we perform here in our clinic. Rotator cuff disorders are very common. In fact, if you have persistent shoulder pain, there's about a 70% chance it's coming from your rotator cuff, either tendonitis or a rotator cuff tear. The rotator cuff is the main tendon in your shoulder. It attaches to your upper arm. It allows you to lift your arm and add power to your movements, like throwing a ball or reaching overhead. Unfortunately, this tendon weakens over time and can tear, either from an injury like from a fall or degeneration, which occurs over time. So if you're having shoulder symptoms, we usually start with non-operative treatment with physical therapy and possibly a cortisone injection. If you continue to have symptoms despite this non-operative treatment, we'll usually get an MRI to assess the rotator cuff. So here's an MRI of the shoulder. You have the ball and the socket of the shoulder joint. On top you have the rotator cuff, which comes down and inserts onto the bone right there. But if we go towards the front of the joint, now we see that the tendon ends right there. There's this gap, which is the tear. This is where that tendon should be inserting, but instead it's retracted back to there. So this is your typical rotator cuff tear on MRI. We use suture to bring the tendon back down to bone and secure it with a special anchor in the bone. So we're in the operating room right now. This is the arthroscope that we use. You can see it's very small. It's a very bright light on the end. It allows us to put it into small spaces and see what we're doing on the screen. And then we can use special instruments to repair the tendon. So this is what we see with the arthroscope during surgery. Just like the MRI showed, the tendon is torn and retracted away from the bone. You can see some tissue left remaining where it should be attached. So we want to repair this tendon back down to the bone. So we have special instruments where we can pass the suture through the tendon. You'll see here how we are able to pierce the tendon and pass the suture through. So we're going to be doing this multiple times to get a nice strong repair with multiple sutures. So we're going to be using two separate anchors. Those 4 blue strands in the front are going to have one anchor, and then we're going to have 4 white strands in the back here, which are going to go into a separate anchor. And you can see how the tendon is able to be brought down to the bone with these sutures. So now we're going to secure these 4 back sutures into the bone. We're going to place them into a very small hole that we make in the bone, and then we're going to place a special screw to hold them in place. And this screw is not metal, it's actually an absorbable screw, so over time this material actually resorbs. So we're going to do the same thing with the 4 sutures in the front of the tear with a separate anchor. So now we have the tendon repaired down to the bone with these sutures being held in place with the bone anchors. So here we are before with the tendon torn away from the bone, and here we are after with the tendon repaired. And now we just need to give this time to heal. So you're going to be in a sling for about 6 weeks and eventually starting physical therapy.